My name is Rob Caturano. I'm the therapy manager here at Orthopedic Institute of Western Kentucky, and today we're going to talk about post-operative exercises after you've had the outpatient total knee replacement. I'm going to show you a few of the tools we use. Make sure you're familiar with that. We use a roller here, a little belt, leather belt at home will do. We use a towel. I'm going to introduce you as well to Corey, who's volunteered to be our patient today. These exercises are very simple, but what we've researched here is the best possible way to reduce swelling and get your quadricep working again, because it's the most important factor after the surgery. The research has shown that kind of slam dunk unequivocally. We have to get your swelling controlled and your quads strong as we can again. So I want to show you what's called a quad set. It's where you have the patient tense up their knee and you want to see the kneecap move. I want you to see the kneecap moving. You'll be sitting up in bed to do this and looking down at your kneecap. I do make you look at it because sometimes you think your quad's doing the work, but it's really not. It's inhibited and other muscles are contracting, and you have to see that kneecap move just to verify that the quadricep is doing the work. Next one I have you do while you're sitting up, get a belt and we wrap it around your foot and we stretch your calf to make sure that it's not getting tight. That fluid has to go somewhere. Now, oftentimes it'll migrate down and kind of fill up this area with a bunch of swelling, and your calf can get tight along with that, and it alters how well you can walk. So we try to focus on getting that looser before surgery, and after surgery we'll do this as well. Just tense it up. Some people are stuck with little deformities in their knees that make the soft tissue back here tight as well. They can't even go straight before surgery. It's been maybe years since they've had their knee straight. So we have to loosen all this up back here to accommodate that and let you take advantage of it once the surgery is done. So we do a few 30-second stretches there. The next thing we do is have you lie down on your back. We do what's called a straight leg raise. I want you to lock that leg straight, tense up as hard as you can, slowly lift it about an inch, and don't let it bend at all. And then back down. And then relax and do it all over again. That's harder to do than the quad set itself, but it's a benchmark for us. It correlates very well. If you can raise your foot up and not let it bend at all, you're strong enough in this all-important quad to be stable up and on your feet without a walker or cane, what have you. So we zero in on that right away. Most of the time on the first visit I have to help people. I have to do the lifting for them. Their quad is just that inhibited. But the sooner they can get the ability to do this back, the better the trajectory with this. Now for the next exercise, I'm going to put a bolster up under her knee. And we're going to use this quad again. I want you to straighten out your leg, and I want you to slowly control that foot on the way down. It's called a short arc quad, and the reason we do that is we want to zero in on the fine control of that quad, just slowly lowering that foot, not just let it flop down. So we try to get the control back, the brute strength in the back, we try to get rid of fluid. And then another one that I will almost always do right after surgery is called a wall slide. And on this one, we're going to ask Corey to get up and move around where her feet are on this end and her head's on this end. And here's where the towel comes in, because you can get in trouble at home if you scuff up the paint job on your wall. But if you do this at home, always use a towel. We're going to put a towel here. I want you to scoot down as close to the wall here as you can get, maybe 5-6 inches away from it. There you go. And what we want to do, we want to let her slide her foot down the wall, and I measure this angle in the post-op visit just to see how far the knee is bending. Don't get discouraged if it's pretty stiff. It's going to have a lot of fluid in it. We'll hope to minimize that, but it'll be a little stiff, and we'll just day to day just measure these angles and make sure it's going the right direction. But we call that a wall flexion, wall slide sometimes. But we try to also spend a lot of time doing this, because the knee being that much higher than your heart, it kind of helps get rid of some fluid, and it's an easy way to let gravity help you stretch. You don't have to really struggle with it. It's kind of hard to get in this position, but once you're there, it's very valuable. So we use this whenever we can. These are some of the exercises that get you the most bang for your buck. We've researched this very closely, and we want to get you started right away with the things that puts you on the better trajectory towards full recovery right after surgery, and it's been working very well. So hope you have a great successful surgery, and when you get back in here, well, we'll pick some of this stuff up and hopefully be familiarized with the kinds of things we'll be doing.